Good afternoon. My name is Susie Rendon, and today I will talk to you about factors associated with carious lesions among young children. Introductions. There are multiple factors linked to risk of protection against dental caries. Among them, we have microbiological factors, those related to previous caries activity, oral agents, macroscopic and microscopic characteristics of humans' tooth enamel, and dietary patterns with the properties and function of saliva, with the systemic state and with the socioeconomic situations. What causes tooth decay?
What causes tooth decay? What is it that lives on our teeth, gums and tongue? Microbes. These microbes can be good or bad, and the bad ones can cause tooth decay. There are many types of bacteria that cause tooth decay. These can be Streptococcus mutans, Streptococcus cybrinus, and Lactobacillus. This is not at all exaggerated. As soon as we eat something, our bad, tiny microbes start to initiate a fierce battle in our mouth. The bacteria use every bit of leftover foods and drink that contain sugar or starch as ingredients to produce acids that can eat away the tooth's hardest surface, the enamel. The wound in the tooth that we've noticed as the dental cavity, and the surrounding, devastating, sticky, transparent film of microbes as dental plaque. Battling the destruction the microbes has brought is the minerals in our saliva, consisting of mainly calcium and phosphate, together with fluoride from the toothpaste, water and other sources. The saliva remineralizes the damaged enamel after each acid attack. This battle of scraping minerals away and cementing it back to enamel is always happening at any time, for as long as the person is alive. A constant acid attack, however, may overburden the ability of saliva to heal the tooth. This means that the frequent eating and drinking of sugar and starch that we all love arms the bacteria to defeat the good guy, saliva. The rate of recovery of the enamel will be outrun by the repeated cycles of acid damage done to it, hence causing it to lose minerals. An early sign of decay may show in the form of a white spot where the mineral is lacking. If action is taken at this point, by supplying enough minerals and fluoride, the enamel can still repair itself, and the decay can be stopped or even reversed. But if we keep consuming sugar and starch mindlessly, more minerals will be lost and the decay process will continue beyond repair. The enamel will be weakened and eventually destroyed, forming a dental cavity. To save the damaged tooth, we require the help of a dentist to fill the hole with materials such as composite resin. Tooth decays can be avoided by eating or drinking less sugar and starches. Frequent use of fluoride-containing mouthwashes, gels, toothpaste and tablets will also fortify the enamel. This is why it's important to brush our teeth twice a day. Donate and help us make medical education universal, free, state-of-the-art, and available to every human being.
Well, application in odontology. Children with cavities in early childhood have twice as many decades, failed, and missing teeth at 4 and 6 years of age as those without cavities. In epidemiological studies, a significant relationship has been obtained between a previous experience of caries in primary teeth and permanent teeth. Caries continues to be the large oral health problem worldwide, affecting between 60 and 90% of the school and adult population, although some countries show a tendency to decrease due to the constant study of its causes and the preventive action implemented. Tips to prevent tooth decay.
Tooth decay happens when specific type of bacteria in the oral cavity produces acids and degenerates the tooth enamel, further making a hole which becomes bigger with time. The main cause of tooth decay is either not brushing or flossing properly, taking too much of sugary diet or diet which is rich in carbohydrates, which harbor more of bacteria inside the oral cavity. Not seeing your dentist for a long time, that is the main reason the tooth decay usually happens. Proper flossing and brushing at least twice in a day. Avoid snacking on starchy and sugary food. Regular visit to your dentist at least 2 times in a year, and cleaning sessions at least twice in a year. Usually it depends upon patient to patient. Patients who are more potent to decay or caries should visit at least every 3 months. And those who can maintain good oral hygiene should make a habit of visiting a dentist twice in a year.
Well, pro and cons. Pro. Risk factors for cavity are generally habits that can be changed. 2. Dental caries can be treated in time by a specialist. 3. Proper tooth brushing helps prevent the growth of bacteria that cause cavities. Cons. Children depend on parents call for proper cleaning. 2. Latin America is the population most affected by dental caries. 3. High consumption of carbonated beverage and poor hygiene continue to affect children's dental health. Tooth decay cause, signs and symptoms, diagnosis and treatment.
Today's topic is tooth decay. Tooth decay occurs when the tooth enamel, the hard outer layer of the teeth that makes up the visible part of the teeth, is destroyed due to the effect of acids that are generated when a thin coating that forms on teeth and contains bacteria, or plaque bacteria, breaks down sugar in the mouth. If left unattended, a cavity or hole in the tooth can eventually arise. These holes can grow bigger over time and may even destroy the whole tooth if not properly treated. Incomplete removal of trapped carbohydrate or food during brushing and flossing can also lead to tooth decay. Cavities are more prevalent among children, but changes that occur with aging make cavities an adult problem too. An essential part of preserving overall health and wellness involves the proper care of the teeth, as well as averting the dreaded dental cavity. A dental cavity is the most famous aftermath of tooth decay and could be a sign of poor oral health and hygiene. Causes. Major components causing tooth decay are eating sugary, sticky foods and beverages. The more sugar consumed, the more acid produced, resulting in teeth decay. Poor oral hygiene. Inconsistent brushing of teeth can cause plaque to build up and damage the tooth enamel. Bacteria and acids. The bacteria present in the mouth can digest carbohydrates that lingers on the teeth and in the mouth, forming acids. Dry mouth. Saliva can help wash plaque from the teeth. A dry mouth with little saliva can accumulate plaque more quickly. Medical condition. Some kinds of cancer treatment that exposes the body, especially the neck, to the radiation can cause the makeup of the saliva, promoting increased bacterial growth. Signs and symptoms. The signs and symptoms of cavities vary depending on their extent and location. When a cavity is just beginning, you may not have any symptoms at all. As the decay gets larger, it may cause signs and symptoms such as toothache, Spontaneous pain, keeping you from sleeping, or inconsistent sharp pain without an obvious cause. Tooth sensitivity, occurrence of tenderness or pain, particularly when eating or drinking something hot, cold, or sweet. These signs are usually associated with advanced tooth decay and therefore require immediate attention from an oral health care provider. Gray, brown, or black spots appearing on the teeth. Bad breath. An unpleasant taste in your mouth. Diagnosis. A quick and simple x-ray is all the dentist needs to detect tooth decay or any other problems. Treatment. The treatment of tooth decay depends on how serious the condition is. For an early stage, the dentist tries to talk about the level of intake of sugar in the diet. He then applies fluoride gel or paste. A fluoride helps teeth by strengthening the enamel, making it more acid resistant. If tooth decay has propagated to the pulp, the soft, sensitive tissue in the center of the tooth containing blood and nerves, this may be removed in a process known as root canal treatment. If the tooth is badly damaged that it can't be restored, it may need to be removed. Your dentist may be able to replace the tooth with a partial denture, bridge, or implant. Even though tooth decay is not totally preventable, the best possible way to be free from it is to keep the teeth and gum as healthy as possible. This can be achieved by regular visits to the dentist, cut down on sugary and starchy foods, avoid smoking. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.
Well, in conclusion, the factors associated with dental caries are hereditary or caused by a high intake of sugar and poor dental hygiene. The child population is the most affected because they depend on parents for the dental care of their children. A correct knowledge